Hello, everybody. My name is Dr. Randy Christensen. I'm a pediatrician. I've worked in healthcare for about 21 years, and for most of that time, I've taken care of underserved kids. I used to work for Phoenix Children's Hospital, and currently I'm working for Nevada Health Center. Nevada Health Center is the largest federally qualified health clinic in the state of Nevada. In that state, we take care of about 50,000 patients that are out in rural communities or in urban areas like Las Vegas. Over the years, I've worked with Children's Health Fund for about 16 years, and I really love my job, and I love talking about this topic. Today, we're going to talk a little bit about out-of-home care, what it means, and why it's important. There's a couple of learning objectives that I'd like to get across. The first is to help you gain a little understanding of what it means by out-of-home care, and more importantly, what it means for providers that care for kids. Today, we're going to learn a little bit about some of the factors that contribute to children ending up in out-of-home care. Hopefully, I can help you gain a little insight into the challenges faced by this special population. And lastly, to really enhance the knowledge base and skill sets needed in order for the provider and the healthcare team to deliver comprehensive and holistic services for these children so that they might enjoy healthier and happier lives. As we begin our introduction to out-of-home care, the first thing that we have to define is the term out-of-home care. That is frequently used to describe the placement of a child in the foster care system. However, the term is much more complex and refers to the settings, to other settings as well. These settings are often determined by state law and may include the following: things like detention facilities, shelter facilities, child crisis facilities, group homes, state institutions, residential facilities, camps, and just other organizations that might be responsible for children in their physical custody or care. As we continue in our introduction, out-of-home care covers the placements and services provided to children when these children must be removed from their homes because of child safety concerns, as a result of a serious parent-child conflict, or to treat a serious physical or behavioral health condition which cannot be addressed within the family. So, who are these kids, and what are the risk factors that providers need to know? Well, first of all, out of home care can take place for kids of all ages and all ethnic groups. Frequently, parents or care providers are financially stressed, so the families have difficulty meeting their financial needs. That becomes a risk. Many kids have so much trouble with their finances that they have problems with homelessness. They're exposed to domestic violence. Sometimes they are malnourished. Many times these kids have issues of neglect and abuse. Frequently, there are multiple caregivers, and sometimes there are prenatal drug and alcohol exposures. Parents or caregivers often have mental or substance abuse issues as well. Just to get an idea of the extent of the problem, in 2014, the U.S. Department of Human Services reported that there were over 415,000 children in foster care at just one point in time. That same report stated that throughout the year in 2014, there had been over 650,000 children in the foster care system. We also look at juvenile detention centers for the year 2010. There were more than 70,000 children in detention centers at any one point in time. As you'd expect, thousands more involved throughout the year. If you just add these two numbers up, you get a large sum. Unfortunately, that's not the extent of the entire problem, and they include other settings as we listed in the previous slide. like to tell you a little bit about a case study so you can get an idea of some of the things that go through. There was a 29-year-old mom, and she was living with her 8-month-old infant in a shelter system. She had the fortune at that time that both were able to access on site services at a clinic right there at the shelter. This provided care that was very in line with the patient centered medical home model. The mom would bring in the infant frequently, asking questions. She would ask about rashes, she would ask about crying, she would ask about fussiness. The team was very appropriate with mom and listened to her carefully, gave her lots of instructions, gave her lots of handouts, connected her with a number of multiple services, but it just seemed like things were getting worse and worse. And mom continued to be demanding and continue to ask difficult questions. How am I going to know this? How am I going to be able to do this? And the team began to worry a little bit about her. So they spent more and more time with her, even though she was very demanding and always seemed to be yelling at people. At one point, it seemed that mom had come to her wits' ends. She took the infant back home after an unpleasant exchange with the team members. She got home. She didn't know what she was going to do, and she grabbed the kid and she took him to the sink and she filled up the sink with water. And she grabbed the kid and she began to push the kid underneath the water. Her plan was to drown the kid, and she pushed the kid under for just a short period of time. And then all of a sudden she picked the kid up and she ran crying back to the clinic. At that time, she told everybody what she had done, and she cried asking for help and could somebody please help her. The team did the appropriate thing, called the Child Protective Services, called the police department. They came. Obviously, the child was removed from the mother's care, and the mother went very quickly into mental health services. The child was seen actually only 4 blocks away from the clinic at a child crisis center. The child crisis center had great relationships with the clinic. They talked daily about how this child was doing, and gave lots of information about what kind of needs his kid had. He had had some special formula and made sure that the providers at Child Crisis Center got all of the information that they needed and all of the discharge summaries and everything that had happened to the kid. Ultimately, the child was placed in short-term foster care. Mom went into long-term mental health care needs and began having great strides in taking care of her own behavioral health, mental health issues. Quickly, we were able to see the child in foster care, and the kid came to the Division of General Pediatrics and saw us there, so the continuity continued. Ultimately, after a period of time, the mom and child were reunited, and ultimately the story had a wonderful end where the mom got the child back and has been living happily and healthily and healthy ever after. They've had great connection to the clinics and to all the providers and all the team that saw them. They said very clearly that the reason why mom was able to go back and avoid doing the thing that she wanted to do or that she thought she had to do was because she had such a connection with the team and they were so involved with her care. That's a kind of care that you hope never has to happen, but if you do, you need to have parents and providers and agencies and organizations that really do care. And I'm going to explain a little bit about what that means, what patient-centered medical care as we get on, but I thought that case might help you understand a little bit. All right, let's talk a little bit about the challenges faced by these children. These children frequently have difficulty accessing healthcare. Most studies actually demonstrate that these children have a much higher prevalence of mental and physical problems as compared to their counterparts. One study even suggested that 90% had an abnormality in at least one body system. There are frequently healthcare miscommunication issues. Things like records have been lost, there's no true continuity of care, and there's quite honestly a lack of preventive health care. As you continue to care for these kids, you can see that they often have unmet behavioral and mental health needs. Things like depression, PTSD, anxiety, and behavioral issues such as violently acting out frequently occur. While you would think that the kids want to get away from their home, very often these kids have a strong desire to stay connected to their family members. They have a desire to go home. Unfortunately, when you begin reconnection or keeping them connected to their family and their siblings, this often presents even more complexity to the issues. There are multiple transfers of care. Sometimes that care is transferred within systems, within facilities. Sometimes it's different care providers, and frequently it's transfers of care even in the hospital system. The caseworkers that work with these kids, frequently they are working in a system that may be overburdened. There's been multiple national media reports demonstrating examples of these problems. Even in my old state of Arizona, we found that there were a number of kids, over 10,000, that didn't have the proper investigations into their cases. And unfortunately, that led to severe consequences. Moving forward, as we think about other challenges that these kids face, we see that if they've been pulled out of their home, if they've been pulled out of different kinds of facilities, they frequently will have difficulty with their developmental growth. And often there's developmental delays. This is further aggravated by the lack of screening that takes place. And often there's milestone regression. So kids go back. So the kid in the case that we talked about earlier, the 8-month-old, that kid was just barely starting to crawl around at that time. And when that infant was placed in the Child Crisis Center, some of those milestones regress, and developmentally the infant went a little backwards at that point. You can also imagine that as you take kids out of school or you change schools, that there's going to be lots of difficulty and consequences there. So school interruption frequently leads to failing grades. Sometimes they're not reading at their grade level, or they're not doing math at that grade level. And that can be very difficult for a child, as well as for the foster parents or the facilities or the care providers that's caring for them. We spoke a little bit earlier about cultural differences, and we really want to make sure that these kids don't have the challenges around their cultures. Sometimes they're moved to different places, and these new foster care parents might not be fully aware or fully sensitive to their cultural needs. Unfortunately, with all the moving around and all the challenges and some of the tragedy there, the future expectations for these kids are very low. Frequently, they're helpless and hopeless, and that makes it very difficult to talk about where do you want to be when you grow up and what do you want to do, and really have them have those hopes and dreams.